Hello, my name is Dispenzieri. I am an associate professor of medicine at the Mayo Clinic in Rochester, Minnesota. I'm here at ASH and I just presented data on a cooperative ECOG trial. This was a phase 2 trial where 44 newly diagnosed myeloma patients were treated with single-agent bortezomib. This trial is different from prior trials in that we selected only patients who were identified as having, quote, high-risk disease. We defined high risk as a very elevated beta-2 microglobulin, or the ISS stage 3 myeloma, the presence of deletion 13, and also a high plasma cell labeling index. Patients who were then eligible and went on to the trial would then get about 8 cycles of bortezomib, given the standard doses, and after those 8 cycles, assuming that their disease had responded or was stable, they would go on to a reduced intensity or maintenance schedule of bortezomib. So instead of receiving 4 doses every 3 weeks, patients in maintenance would get 2 cycles in a 4-week period. We found that the overall response rate was about 50%, which is comparable to what's been seen in other trials that haven't stratified for high-risk patients. When we break it down to the various risk factors, including the high ISS stage or deletion 13, either by metaphase, cytogenetics, or FISH, or if we look at the translocation 414, which has also been implicated to give less than average overall prognosis, response rates were relatively equal across the board. This was quite exciting because this would demonstrate that bortezomib is equally effective in patients with high-risk disease as it is in patients with standard-risk disease. The progression-free survival in these patients was about 10 months, and the overall survival has not yet been reached. In terms of duration of response, the median progression-free survival is 10 months, and at 1 year, the overall survival is 90%. In terms of side effects, the program was well tolerated. The most common side effects included low blood counts, especially a low platelet count, fatigue, peripheral neuropathy, and a low sodium count. We were pleased with these results because it basically demonstrates in the upfront setting something that's already been shown in the relapse setting. What that is that patients with high-risk features seem to do especially well with bortezomib. This will therefore be a very good building block to design new high-risk trials for patients with myeloma.